I think unfortunately many Americans suffer under the premise that more care is better care, even though we have multiple careful studies that show that that is not the case. In fact, often when we carefully analyze technology or intervention that is expensive in a given healthcare condition, we may discover that it brings no benefit. In my area of cardiology, the most clear example in recent years has been coronary artery stenting. The National Courage trial, in which Mayo participated, showed that in many patients there was not an advantage in outcomes by doing coronary stenting, that they could be managed with medical therapy first and then only come to a procedure if their chest pain wasn't controlled. That message has been re-emphasized this week in the Barry 2D trial in mildly symptomatic diabetics, which was directed by Robert Fry, one of my colleagues here at Mayo, which again found that stenting in mildly symptomatic diabetics with coronary artery disease did not bring any healthcare benefits. It's a technology, it's an expense, but it doesn't always bring benefit, and the patients in that study did not benefit. It's an example of where more care isn't necessarily better, and we need to educate Americans about that, because many of them operate under the assumption that if my doctor does more, I'll be better off. And that isn't necessarily the case. In many cases, they'll actually be worse off. But certainly, we as a society cannot afford to spend healthcare resources in situations where they bring minimal or no benefit. We can't afford it anymore. The country is basically struggling with the budgetary implications in the federal budget and at a state budget level of increased healthcare spending.